So I'm going to talk about ketamine today, ketamine infusion therapy mainly, but we're going to talk about the reasons, the routes, the rituals, and the results. Okay, so why ketamine? There are a lot of really, really good reasons for ketamine. The main one that I like, and it's not even the reason I got into it, but the main one that I like is that most of the agents that we have out there right now for psychiatry are more harmful to your body than good. They hurt the systems, they hurt, and people end up with problems with their sugar levels, they have problems with gaining weight, problems with sexual, performance. All of these things really, really do harm your body. And most of these medications only work for a certain period of time, and then they got to try something else. So people are always on a cycle of, it may work for a little while, and then they come back down, and then they have to start something else, and it might take 2 or 3 months for that one to work. So all of that aside, that circus and how it hurts people, I really like the fact that ketamine is a helpful drug. It actually works almost instantly, and it's very neuroprotective and neuroplastic, meaning it's creating new neural pathways. All right. So if you get your infusions and you're starting to get rolling, you're not only helping your body get over the symptoms, but you're helping it make new memories and new pathways so that you're not hurting yourself. You're actually healing yourself with it. Okay. It is an easy on, easy off medication. So the half-life is very short. Usually a ketamine infusion treatment is about 40 minutes. And within 10 minutes, 15 minutes after the infusion's turned off, you're ready to get up and go home. Now, you can't drive just because of the nature of the beast, but it is something that comes on and off. Now, in relation to other psychedelics, something like psilocybin, like magic mushrooms, LSD, ayahuasca, all of those are 4+ hours. Some are up to 12 hours. And so it's really, for a 30-minute window, 40-minute window, it's very doable for people to use this for treatments and still be in their active daily lives. So it's very easy on and off. It's a very safe medication. It is on the World Health Organization's list of necessary medications. It will never, ever be avoided by the government or something that they put an illegal on. It's something that we need. We used it in the battlefields to help people with anesthesia and pain when we had to do things out in the field. That was the only anesthetic that there was, and it was a wonderful drug. It takes you to another place. It instantly cures your pain or gets rid of it for a while, and so it was very, very necessary. So that being said, it's very, very safe in that instant, in that moment, and anybody getting it, there's very few contraindications, few psychiatric medications, hypertension that's uncontrolled, or even cardiac disease that is angina in nature. So we wouldn't want to give ketamine to people like that because it's going to increase your heart rate, increase your blood pressure. And if those aren't in control, it's just going to make it worse. Okay, so those situations only. Generally, I've given it to anyone from around 3 years old to all the way up to 89. That was my oldest client, and they do very well with it. Okay, it's very comforting. If anybody has ever told you about being in the ketamine space, they will tell you about it's like almost like the room is giving them a great big hug. It's a very, very quelling, comforting, soft, smooth. I call it squishy. It's a very nice feeling. Okay, and in the context of ketamine IV, ketamine IM, all of this is in microdosing. Now, it can be very scary if you're going to give too large of a dose, or I shouldn't say too large, but a very large dose, heroic doses that people go for. Those can be very harrowing, very nightmarish. You can end up having bad dreams for a while. These are microdoses. We're talking 0.5 milligram per kilogram. So in anesthesia, just to be clear, on a daily basis, I can give 200 milligrams of ketamine to a patient who has anesthesia or needs anesthesia or needs pain medication. Maybe they're under already. We give maybe the same size of a patient, 45 over 40 minutes. So it's very, very small doses over a period of time. Okay, so it's not going to be anything harrowing. It's not going to be anything bad dream provoking. It's very smooth, squishy, dreamy, like you're in the universe and you're very, very calm. Okay, so it's a very comforting experience. In that vein, it works, kind of a pun. It works very well with therapy. So lighter doses allow conversation. When you're in the ketamine space, you're going to be led down the paths of, where your issues are. If you need to be thinking about certain things, it really brings you to spaces where I really need to think about this more, or I'm really having trouble with this, and I really want to work it out. And so generally it goes to that space of consciousness that you really need to work on, because it's the foremost of your thoughts most days. So you're going to go into that space, and just like you dream about it when you fall asleep, you're going to go in and you're going to think about it. You're going to have conversations with yourself or other people that might be able to help you in that space, and you're going to work through your issues, and you become very uninhibited. And so therapy is very, very conducive to this state. You can talk to someone who's in a ketamine state and say, who are you seeing? Does it frighten you? Are there things that you want to learn from this? What do you think that you're trying to learn? You can really direct what's going on. Okay. So, that being said, a lot of people with PTSD, and it's become very, very popular with that crowd, because they're very inhibited. It's very difficult to get to the core of the issue of your trauma, and you really want to be able to work that out, but it's very difficult in any other method. And so in the ketamine space, you can get in there with certain types of therapy, mainly IFS therapy, the internal family systems that we'll be using here. And so you can discuss with each internal part, your protector part, your inner critic, your inner child, any of those people inside of you that make up your internal family that is hurting. You can talk to each one of them individually and heal them individually so that they all play well together. Mm-hmm. And that's kind of how that works. Okay. Mm-hmm. So it works very well with therapy. Becoming very popular with other IFS therapists. So where do we give this medication? How is it the routes that we use? We can use a lot of different routes for ketamine. It only differs by the bioavailability. Now, the best bioavailability is IV. So you push that into the intravenous system, it's 100% available. It's going to go and hit those neurotransmitters, those spaces that you need it to soak in, and it's really going to be affected instantly, and almost within, I would say within a minute and a half, you're going to be feeling something. Okay. I am a little less so. It's going to be about 75 to 90%, depending on how you uptake things from your tissues. Okay. Takes about 10 minutes, 8 to 10 minutes for you to feel something. Okay. And it'll vary too than how quickly it goes off. Of course, in the IV, it's going to go off quicker. IM is going to take a little longer. Okay. IM meaning intramuscular. So it's a needle into a muscle. Orally, less than 50%. And then you have the pass of the stomach. This is like into the submucosal. So it would be getting in that way, getting you the best options. But if you swallow it, then you're going to get a little bit more. But a lot of those stomach acids are going to eat it up too. Go ahead.
I have a question. What do you think about troches? When you put under the
that troches. Yep. That's what I'm talking with oral. We're not
15.
Something we're really swallowing. It's something that's soaking in.
That's still only 15%.
50% or less. Mm-hmm. Sometimes even like 25%. It's not very much. So if you have someone on 600, how much are they actually getting? It's not very much. Mm-hmm. Okay. So that might sound like a mongo dose, but it's really nothing. It's really nothing. You can also get inhaled. And inhaled is that Spravato that everybody's raving about. It's the one that is currently the only form of ketamine that is FDA approved for depression. And the only reason it is because it's not actual racemic ketamine. Now, ketamine is an R and an S component together. Racemic meaning together. That's the IV dose that we give. That's the IM dose that we give. Inhaled is only S-ketamine. It's only half the molecule. What they were trying to do was separate out maybe the bad effects and get rid of those and just go with the one. But we're finding that without the racemic, meaning both chemicals together or both parts of those chemicals together, it doesn't work nearly as well. You need both of those to make it do the job the best. Now, the inhaled does work. What I like to see it be used for in the future is maybe a rescue thing for people with migraines. Okay, that's going to be very, very helpful very quickly, and you could actually prescribe it for somebody at home. That's what I want. That's not to say what we do now, but that would be what I want. Or in the ER setting, if they come in, they got a bad migraine, and they're just really not able to get an IV or whatever. Boom. Okay.
I was dreaming about something like that with NSAIDs, something like I can just spray them in here and like get the headache.
Wonderful thing. Otherwise, people with treatment-resistant depression that are averse to IV therapy or don't like needles, we can use it on them. The efficacy is not really there. They thought it would be. It's not really proving to be as long-lasting as something IV.
So why they use only S form of ketamine in a nasal?
Well, they wanted to get rid of. They thought that all of the bad tendencies of ketamine were in the R. And so they chose the S because they felt that it had most of the helpful qualities, but also because it was chemically different, it could be put through the FDA, and then people could charge insurance for it.
So compounding pharmacy technically can make ketamine inhaler that has an S and R.
They can.
So we can get better nasal sprays.
Yes, you could. Okay, but the one that's covered by insurance
Is
the brand name. And it's only S, as ketamine, okay? Okay, so how do we give it? We give it in a 40-minute session, very controlled, specific space of time, IV, for all of the above. We're talking anxiety, depression, treatment-resistant depression, which is those people that have been trying every little pill and it never seems to work, or it just nothing really works well enough for them. I've given it to people with bipolar disorder that are not in a manic phase. I've given it to people with chronic pain. And I've given it to people migraines, anxiety disorder.
You're talking about the Bensound one?
No, I'm talking about IV.
The IV.
Obsessive compulsive disorder that is not have manic tendencies. People who are in long-term depression over grieving. People who are having pain and are at the end of their life in hospice. Fabulous. Really want to work that one a little bit more so that we can offer that to people who are in a hospice situation. So, but done all of those things and really life-changing. The other thing that we're talking about, and the things that I've done for people are people in recovery, people who are addicted, people who are alcoholics. And it's a wonderful thing. It's very, very good for recovering. If you're in the moment and you're still using, I cannot say that it's a safe thing to do. And alcoholism, yes, if you haven't had anything to drink in the past couple of days, but if you're still currently using, it can cause, very wild dreams. It can cause very untoward effects of feeling very out of control, things like that. Plus, if you have drugs on board, meth, cocaine, things like that, you can also cause heart problems. So, okay, but it is good for rehab. People are really looking into it to be a rehab agent. Now, the other rehab medication that is a psychedelic and the same type of thing, and we can talk a little bit more about different psychedelics in a minute, but there's one called Ibogaine, and Ibogaine is not legal in the United States, but there is a project, I think through Stanford, that is working with an area in Mexico where they are working with veterans for PTSD and addiction.
Yeah, they sent them to Ensenada from San Diego to get that.
It's a wonderful thing. Now, I was at a psychedelic conference here in town this last year, and that's when I was first introduced to that concept, and it's just an amazing thing. Yeah, people in that project were there and talking about it. It's just wonderful.
So we will be able to do those infusion with Ibogaine in our partner clinic in Tijuana, or with.
I think you could do it. I think that is the intensity of an Ibogaine experience requires people who are very, very comfortable with it. It is probably the strongest psychedelic, and from what I'm told, from people who have done it, you'll do it because you want to be healed and well, and it cures addiction.
It's almost like
but
as ayahuasca.
No, it's much more.
Oh, wow.
It is a very, very intense experience, and the people who have done it, they'll say they're glad they did it, but they would never do it again.
Oh.
That's how intense it is.
Wow.
Okay, so it's a very, very harrowing experience. Okay,
What was its name again?
Ibogaine.
Now, is that a root or where is it derived?
Ketamine, the same kind of like.
It's a
not
psychedelic,
man-made.
but it's no, it's I don't believe it's man-made.
I think it's from some plant.
Derived
It's like
from
a
plants.
tea or.
Yeah. So I'm not quite
But
sure.
they
They
just
don't
do
do
in Mexico and Ensenada, they do infusion for like PTSD guys. Actually, some of the foundations cover it, and they send guys from San Diego to Ensenada, like specific place
Yeah.
to get those.
There's a very large study going on that has in conjunction with Stanford, and they're working on trying to make it available to people in the United States.
Yeah.
Okay. So the other thing is I do ketamine-assisted psychotherapy, and ketamine-assisted psychotherapy is generally done. I do it with an IM injection. Initially, I'll give a lighter dose, and then after 10-15 minutes, I'll give a heavier dose. And it puts people into the ketamine space enough that they can find their issues. And then as they're coming up and out, we have a session. And so that takes usually about 2 hours for the trip and then for the therapy together. Usually people like to have it in a little bit more shishi environment. We do have like a mat on the floor. We have a really calming sense of music going on. If the room is dark, and we like burn sage, and then have like singing bowls and stuff, and it's very, very I would say religious experience kind of thing, but spiritual experience, let's say. And so that's a little bit more I call it shishi, but it's very very not unlike having an ayahuasca experience, but kind of abbreviated. And it really does help with finding your inner needs and working through them.
So you're not doing any of this therapeutic part of that, like verbal, while they're actually doing the ketamine, or while they're coming out
You
of it?
can't. It just really depends on the person. Because
Okay.
I know when I was under, I
You
could
didn't
barely speak.
Okay.
But some people just talk all the way through it. So it really depends on when they're ready.
Interesting.
Yeah. And like I said, then too, how do we do the other things that are involved with ketamine, the pain treatments that we do. We offer for CRPS, it's chronic regional pain syndrome. There is almost very little treatment that helps with that, and almost no cure for that. Ketamine seems to really help. I've seen people, go without symptoms for months and months and months after a phase of pain treatment. So they're 4 hours for 5 days in a row. And sometimes they need to be sedated through that. But that's a wonderful option for them, and it really does work.
So you have different kinds of treatment depending on what the patient or what they're suffering from.
What is needed?
So some of them are IV and some of them are
Some
IM.
IV, some IM. Most are IV.
Mhm.
More when they get into the therapeutic, it's more IM, just because it's a little bit softer experience. You don't have to have the IV hooked up, a little less monitoring involved. It's not as intense.
So on this chronic regional pain syndrome, like your arm is hurting every day and nobody can touch it. How is it effective? It's a brain problem?
It is. And what ketamine does, it goes in and it resets that default mode network in your brain. It gives it a hard stop, and then it allows other neuroplastic tendencies to happen. You can get new neural networks. It's telling it not to go down that, because what's happening in chronic regional pain syndrome is that it's neural memory, right? Even if you cut an arm off, the fingers still hurt. It's neural memory. It's not actually still there giving you that response. It's gone, right? So same thing with chronic regional pain. It's healed, but the neural memory is what you've got to fix. So what you're doing is you're telling the neural memory, stop it. Don't go down that way, and we're going to interrupt that so that we don't give the brain this response that you're having pain. Okay, so we're stopping that, and in the same time, we're encouraging new neural growth so that we have new responses at the end so that there is no pain. That's what happens. Okay.
If you're gonna be doing this in this setting, are you gonna have medications to lower the blood pressure, epinephrine, your whole armamentarium as you would have?
We have everything available on a crash cart that we need. I also have Labetal at the bedside. I am an anesthesia provider as well, and so I'm really adapted to doing those things.
Available.
Yep. We even have an AED. We have oxygen. We have, crash cart capabilities. We have all those medications. So yeah, and I wouldn't suggest anybody, who was not ACLS certified be, unavailable. I think that somebody should always be available that's ACLS certified. We've got plenty of those in the building. So
We do.
Yeah. What do you think about people that, we have one patient that came and she said she did intrarectal?
yeah, I don't. That is just outside. Was that given by a clinic?
No, she got
Yes.
it somewhere and she's doing on her own. And
Yeah, that's not medical.
Mhm.
That's like recreational.
recreation.
Usually they go rectal for and vaginal. They do that
I
for.
think she would get a prescription somewhere, but I'm not sure. She came here for actual IV infusion.
Yeah.
With ketamine. And she told us I need a higher dose because I've been doing this often intrarectally.
Mhm. So, and also if people are recreational, they need to have a promise and a statement that they're stopping that,
That's true.
because we don't know what they've had at home.
Mhm.
That's why, and a lot of times when people need rehab, I really don't get into that as much if they're currently using, because I have no idea what they're doing.
Mhm.
And that's just dangerous.
Yeah, that's true.
So if somebody's been through rehab, they want to stay off it and they want to, rewire their brain, we can do that with ketamine.
Mhm.
But I'm not a rehab center.
Although there's testing you can do in the urine. And,
You can.
COS.
We would have to have the UDS on everybody. Mhm.
Mhm.
So that's a possibility.
Mhm.
Have you
But
heard of rectal?
I have, do you guys ever, I leave through Reddit because that's where everybody talks about it. And I just want to know what they're doing,
Mhm.
so that I know when I don't look stupid when they walk in and start talking about it. I say, oh yeah, because and I also know the doses. I know what they're feeling. I know what they're going through because they talk about it on Reddit. It's really amazing. Yeah. Kind of have to know what your public is.
Yeah.
So future possibilities. We want to know where we're going with psychedelics. Okay. Ketamine is the only one that's legal right now, right?
Mhm.
But we do have the decriminalization of psilocybin going on. In most states, we have that starting anyway. And then we also have MDMA coming out at the end of next year, hopefully going to be able to be used for therapy. MDMA is a drug called ecstasy, but it's therapeutic grade and it's very, controlled of what it is. But we use it for, obviously for couples therapy. We use it for people who have gross trauma and, very intense in the moment, recent. But also we're on our third stages of trials for MDMA for PTSD, and they're finding it to be curative.
Wow.
Okay.
And also IV.
Yes. So, MDMA, I believe, is in pill form for the therapeutic realm. Okay.
Mhm.
I'm I'm not sure
When they do it
what
for
it's gonna
couples
be.
Therapy, they do it like.
I believe so.
Yeah, it's like Molly too. It's also like Molly on the street.
Molly, it's
Uh-huh.
the same, yeah.
It's the
It's
same
just a
thing.
little bit
Because
different
it's like
therapy.
a kind of like a bonding
It's
drug.
very serotonin.
Very serotonin.
Yeah.
Exactly.
So,
Receptor, so.
that we have, I would love to be able to prescribe microdosing of mushrooms. I would love to be able to use MDMA in our therapy. I would love to be able to use a mixture of whatever we need to make people better. But all of these things are just coming down the pipe. You know, it's too bad that, you know, in the 1970s, in the days of Timothy Leary, you probably have all have heard about why the government shut down the use of psychedelics and what happened with that. The people were experimenting with it on the side, along with experimenting with it in the clinical setting just to see what it would do. And, you know, people got scared because it was just so different and weird, you know. And so they were afraid, but it didn't mean they weren't still using it in government situations. But they stopped allowing the public to use it or even them to use it for research. But they did find it curative at that time, LSD, for alcoholism. How many lives we could have saved in the last 50 years?
Exactly.
Okay.
You read that book, yeah, How to Change Your Mind. Yeah.
Yep, Michael Pollan.
Mhm.
It's the first book I read.
Oh, yeah. Really?
Yep. I have a friend of mine from high school. She's a shaman, and she leads ayahuasca journeys. And she told me about that book. So the future possibilities for psychedelics, I believe, are going to be getting far, far away from the big pharma and all the crap they shovel down mental health patients' throats, and getting more towards the healing aspects of psychedelics. That's my mission. That's my goal. I've always been in the business of curing people's pain, but now we get to work with, you know, helping people's pain in another whole route, mental pain, physical pain, and all of that. So that's me. That's why I'm here. That's what I do.